everyone. Joseph Onesta, type 2 mentor here. Checking your blood sugar and keeping control over your blood sugar is extremely important. On the other hand, it may not be enough. In fact, I know it's not enough. So let's talk. As Joan Rivers used to say, can we talk? All right, can we talk? Listen, 10 years, upwards of 10 years, perhaps even more, before you were diagnosed with type 2 diabetes, you began a chronic problem called hyperinsulinemia. Hyperinsulinemia is fairly common under the standard American diet because of the high level of carbohydrates in our diet. And of course, we're told these things are absolutely healthy. You know, you can see the word healthy and natural and all. The thing is, we were not really designed to consume that many carbohydrates, particularly when we eat as often as we do. And as diabetics, we may have been told to get upwards of 60% of our calories from complex carbohydrates. There's not much difference. I mean, if you do pre and postprandial, whether it's complex or simple, it's not much difference in any case. But complex carbohydrates, and we're told to eat every 2 hours to keep our blood glucose levels level. Now, that's not bad advice for what it is, except that the goal of keeping blood glucose levels level is really just putting a Band-Aid on something that needs stitches. Let's go back to hyperinsulinemia. So before we were diagnosed, hyperinsulinemia is the way we get there. Hyperinsulinemia, all that means is we're consuming so much of certain kinds of food that our pancreas has to work overtime to create enough insulin to get the glucose out of our blood. We're not using all of the glucose we are consuming. You know, you've heard calories in, calories out. I don't talk about that at all. This isn't about counting calories. It's really about what is so immediately converted into glucose when we eat it. And that is carbohydrates, sugars, fruits, things that are starchy. These things immediately spike or raise our blood sugar levels, which is what the doctor cares about, right? Those blood sugar levels coming up. Then the pancreas has to work overtime creating extra, underline that word, extra insulin. And it's the insulin, because there's no place else for it to go, the insulin starts carrying all that excess glucose to our liver, where we end up with fatty liver disease and obesity, because the liver has to do something with all that extra glucose. And then we're told to eat every 2 hours so that our body doesn't really have an opportunity to deplete the glucose in our blood and then need glycogen, that sort of short-term storage. The point is, if all you're doing as a diabetic and you're satisfied with, okay, my blood sugars, they're not exactly what I'd like, but they're under control and that seems to be okay, and maybe the doctor will give me another medication, maybe one of these ones that'll actually help me lose a little weight. Here's the thing. Addressing the symptom and not the cause is the problem. I haven't been diabetic for 5 years. And no medications. Why? Because I did a little bit more. And so I'd like you to know this is very simple stuff, but understanding that if we don't eat the foods that spike our blood sugar, we'll need less insulin. If we need less insulin over a long enough period of time, then we don't graze all day. We eat normal meals. Chances are our body will then eventually need to use some of its stored energy, the glycogen in our liver and in our cells, and then maybe even go into looking at getting some of that fat and using that as energy. If we're going to help our diabetes and give our bodies the environment in which our bodies need to make changes and to reverse diabetes, then we have to stop spiking our blood sugar. We'll talk more about that in another video, but let's just say this, give you one hint. For the next week, just 1 week, see how it happens. Keep testing your blood sugar. I want to know, right? I want you to know, really. And then just whenever you're sitting down to eat your food, first of all, always put it on a plate. Don't eat out of a bag or a box. I tell my clients this all the time. Plate everything that you eat. Then whatever is on that plate that is a carbohydrate, that's your normal portion of carbohydrates, cut it in half. You want to eat more. If you're still hungry, have some above ground vegetables or more protein. One portion of just a half portion of carbohydrates and full portions of everything else. And go ahead and eat the meat. Eat the vegetables, above ground vegetables. And we'll see. Give it a shot. And let yourself actually see what happens. Even if you're wearing an insulin pump, you'll use less insulin. Joseph Onesta, Type 2 Mentor here. If you're watching this on YouTube, like and subscribe if you want to know more. I'm not monetized, so I'm not getting money from, and I don't know anything about the commercials you see, if you see any. If not, look for me on Facebook. Okay, Joseph Onesta, Type 2 Mentor here.